acid blockers are probably the next category that are used the most common. And so much has come to light in the last year. And I'm so glad to see gastros really understanding the toxicity of these medications.
You're listening to the Ethos Athletes podcast, where we believe that your health is the number one resource you need to accomplish your dreams. My name is Dr. Matthew Hernandez, and I'm a physician dedicated to helping my patients maintain their active lifestyle and continue doing what they love. I'm sitting down with other experts so that we can provide our listeners with the knowledge they need to improve their health and live their best life. Hey everyone, this is Dr. Matthew Hernandez, and you're listening to the Ethos Athletes podcast, where we are going to be continuing our series on gut health and the things that affect your gut health as a whole. On this series, we brought on special guest, Dr. Michelle Retz, who is the head of gastroenterology at SCNM and also a physician here at Ethos Integrative Medicine. So Dr. Retz, welcome back to the show.
Thanks so much for having me.
In our previous two episodes, we've talked about a big overview of gut health. The last episode, we talked about digestion and how digestion really can go and impact everything further down the chain when it comes to gut health as a whole. Now, one of the questions that I forgot to ask you and I wanted to kind of elaborate and expand on from the last episode actually has to do with gallbladder. And you talked a little bit about what the gallbladder does. So let's do a quick overview on that. And then the question I have is, there are a lot of individuals who seem to have gallbladder issues that end up in the ER and they are told that they need to have their gallbladder removed. Sometimes that's the case, and I'd say probably the majority of the time it's not the case, but they're never really given that option or told how removing the gallbladder impacts them down the road. So would you be able to touch on that before we get into the new episode?
Absolutely. So the gallbladder is a little sac that stores bile that the liver makes. Bile is the scaffolding that holds up the fats that we eat so that the lipase made by the pancreas can chew it up. So it actually helps solubilize the fats that you eat. All the fried, greasy, fatty food, but also the avocados, the coconut oil, the nut butters, the nuts and seeds, your olive oil. That's where bile has its role. Bile also helps the gut move forward, so it does play a role in gut motility. There's a few specific things that can happen with the gallbladder in terms of disease. Most commonly, gallstones. So that's usually, folks are having pain up in their right upper side of their tummy, usually within 1 to 3 hours after they eat. And it's usually after they eat fats. They're having trouble either putting out bile, making it's very thick, or they have a lot of stones that are blocking the gallbladder and they can't get the bile out. So what they're feeling, that pain is like a squeezing, spasming pain as the gallbladder is struggling to put bile out to help you digest your food, but you just hurt. And then that fat doesn't get digested, so it runs through the gut really quickly and ends up in the stool. And so those stools look lighter, they float. You may even see some fat in the stool. So that's a note that you're having an issue with your gallbladder and with bile, usually. The few things that can happen with the gallbladder, like I said, most common are gallstones. You can have an infection in the tubes where the bile comes out. You can have inflammation, chronic inflammation in the wall of the gallbladder, which is a risk for infection because it can get a hole in it and burst, basically. Or a stone can actually get out and then block the duct, and so that's an emergency too. Most people, though, have gallstones, and they say, well, if your pain is that bad, let's go ahead and take it out. And if it's not that bad, then let's wait until it gets that bad and then come see me when it is, and we'll remove it. And I've been able to save every gallbladder that's come my way. So you can have a gallbladder full of 100 stones or one stone. It doesn't matter. We may not be able to get them all out, but we can absolutely dissolve a lot of the smaller ones and medium-sized ones. We can help your liver produce what I call gorgeous bile, which is thin, right? It flows very easily. You can put out what you need to digest your food. Folks who, are in this quandary are just left to go, well, I guess I have to hurt until it hurts so bad that I have to get my gallbladder removed. But that's not so. If they've been told, well, we think it's your gallbladder, also this will happen, you don't have any stones, then they need to do something called a Hydus scan, which is a test where they give you a hormone to see how much bile you put out. And if you don't put out enough, they'll say, well, it's not functioning. Let's go ahead and take it out. It's not of any use. That's not true. We can absolutely reverse the functioning of the gallbladder and make it function so much better. Just yesterday, I had this success with another patient, a young 18-year-old gal who had been having severe nausea and heartburn. We did the ultrasound. The ultrasound was normal. It showed no gallstones. And then I did the HIDA scan, and anything under 40% is considered low function, low bile that you put out. She was at 26%. And she had pain when she did the test. So we already knew that was the thing that was causing the problem. Typical gastro would say, okay, we need to remove the gallbladder. It's bothering you. You take it out. You'll feel so much better. People who have their gallbladder removed, at least a third, usually up to 2/3 of folks have chronic diarrhea because the bile is still made by the liver, but it's just coming out now. It's coming out in spurts. It's not coordinated with meals. And so they're not digesting their fats, and then bile's just coming out at random times, and it's creating increased motility at the wrong times. So they're prone to chronic diarrhea. Other folks can have constipation, but usually it's chronic diarrhea once they have their gallbladder removed. What I do is offer them herbs that are called cholagogues and choleretics. Cholago, I teach my students, helps your body make more bile to flow more smoothly. And choleretics actually help the liver make more bile, make good quality, thin, gorgeous bile, like I say. So we use these herbs, and then we use substances that are called lipotropics, lipid or fat-loving substances that help the liver, again, create gorgeous bile. And bile dysfunction, or even thick bile or having stones, is reversible. Now, large stones usually cannot be dissolved if they've been there for a long time, but small and medium-sized stones, they're made out of cholesterol and bile. And so we work on looking at the cholesterol piece and making sure their cholesterol is normal. And again, they're putting out thin, gorgeous bile, and usually we can resolve that. And then I just may recommend a nice little gallbladder flush, maybe every 6 months or once a year, just to help make sure things are moving smoothly. We could retest the HIDA scan. I had a gentleman who had 4% functioning gallbladder. I got him up to 60% in 3 months when we redid it. And the surgeon had said, you got to have it taken out. And we totally saved his gallbladder.
Awesome.
And just with the lady yesterday, same thing. Within a month of just doing these simple supportive measures, she has no pain and her gallbladder functions completely normal.
That's awesome. Right on. The 3 follow-up questions to that. So question number 1, is there ever an instance where individuals have, they could be completely normal, they have an acute gallbladder pain, and then they end up, or they have an acute pain, what does that look like? And then, they end up in the ER, and they're told they have to have their gallbladder taken out. Is there anything that, they can kind of be empowered to do, or some things that they can think about in order to determine, is this right for me?
Yes. So first and foremost, it's an emergency if you ever have a fever and abdominal pain. Yeah. So if what you're having and you have a temperature over 100.4, I myself will send you to the ER, if ever. So that is legitimate, and you should be there because there's a risk of infection, and there's a risk that something could get a hole in it and the bacteria could go throughout the abdomen. So that's why we send you to the ER.
Makes sense.
It also is, if it's a stone blocking the duct could burst, or the stone could cause pancreatitis, which is the pancreas digesting itself. And that's an emergency. Yeah. So those are the events that we say, okay, you've got to go. When the pain is a 9 out of 10 or a 10 out of 10, it's hard for us to know what's going on. And some of those more serious issues are on our most prevalent thoughts. We need to send you to the ER. But oftentimes they'll be having this pain in the right upper side, right under the rib cage, an hour to 3 hours after they eat. It can be a spasming pain. It can radiate straight through to the back or to the right shoulder. So it can even look like shoulder pain. An hour to 3 hours after they eat. Usually it's a fatty meal, or the biggest foods that aggravate gallbladder are eggs because of the cholesterol content, fried onions because of the fried food that's around them, because people have onion rings a lot, and pork. It's a fatty red meat, and that's really common. Eggs and sausage, or they'll just have a pork chop or something like that, and then after that specific meal, they notice their pain is much worse. Our patients who may be vegetarian or not having red meat or something may just be having a lot of healthy fats, right? A lot of olive oil, coconut oil, MCT, avocados, nut butters, nuts and seeds. Those are still good, healthy oils, and those can do it too. So after having a higher fat content meal, they get this pain that lasts for several hours. It can be quite significant, feels like a bad spasm. And nausea. Nausea usually comes with gallbladder issues too. Nausea after a meal, it can, sometimes it's confused with an ulcer, and it certainly can look like that, but they don't really have heartburn. They have pain in the right upper side, and they're really nauseated after a meal. And then it kind of goes away. If they're at the ER, they'll do a CT scan. It's the fastest way to assess them. And if they see the stones and the pain is that bad, usually they'll say, we need to take your gallbladder out. I've had several patients who did not have a fever. It was not an emergent. If there's a fever, they absolutely will and probably should take it out because there's a risk that there's a bacterial infection and the wall could burst and it could be really bad.
Yeah.
So that's legitimate.
Perfect.
And people shouldn't feel bad if they had their gallbladder removed when they had a fever.
Okay.
If they didn't, then they do have other options. And patients come to me after that and say, I just didn't want to have it ripped out right then. I didn't feel like it was an emergency. Nothing's on fire. Yes, I'm in pain. It's not all the time. What can I do? And those are the folks that I'm talking about, either
Awesome.
with the stones or that had the functional testing done and it said, okay, my gallbladder doesn't work that well, but it's not broken. It's just dysfunctional. Can you help me?
Okay.
And yes, I can.
Awesome. Perfect. For the individuals who, whether or not they had a fever, they had the gallbladder taken out, what are some things that they need to be aware of that, like how this will impact them down the road? You mentioned chronic diarrhea being one of them. What else do they need to consider? Is there anything that they can do to kind of get their GI system back in track after that?
Yeah. The biggest thing is the chronic diarrhea. Most people, they're not told when they get their gallbladder out, that's a thing that can happen. So they're just told they're going to feel better. One, they may not. So that may or may not have been the issue. If it is, usually they will feel better, but because bile helps move the gut forward, like I said, now they're prone to chronic diarrhea and putting bile out at random times. So they're going to have trouble digesting their good fats. Then we worry about digesting our fat-soluble vitamins, A, D, E, and K. And that has its effects on the eyes, the bones, the thyroid, the liver, right? Calcium levels. Vitamin E is a fantastic antioxidant that also helps with cholesterol and bleeding, and vitamin K also for our clotting factors. So it has a wide-reaching effect when you don't absorb your fats. And when you're having chronic diarrhea, that's a quality of life nobody wants, right?
For sure.
And then you just can't enjoy your good fats. I mean, they're valuable to you. Your omega-3s, your omega-9s, right? These are good, and every cell is coated in fat. You need them to build your cells.
Yeah.
So yes, absolutely, you can have support. If you're not vegan or vegetarian, you can actually take ox bile support.
Okay.
So with each meal, you could there are digestive enzymes that are a little more complete that have stomach acid and pancreatic enzymes and the bile piece in them. Or at the very least, they're going to need to take bile support for the rest of their life. For my vegan patients or vegetarian patients, I'll give them just lipotropic support, which is what helps them make bile and put that out with each meal. So I give them what the liver needs to make a thin, gorgeous bile, and then they take that with each meal. And that's enough as well. So if there's if they don't want to use something that actually comes from an animal, you can use the cofactors that the body uses to make the bile, and that's sufficient as well. Really, it's about motility, making sure you're absorbing your good fats and you're not having diarrhea, and then you're fine.
Perfect. Awesome. Thank you for enlightening me on all the gallbladder aspect of it and giving our listeners information to use to kind of really help empower them on making a decision whether or not this needs to happen to them.
My pleasure. You can save your gallbladder. Come see me.
Perfect. Let's move into the new topic we want to discuss today, which has to do with absorption. Again, we talked about digestion. Now, when we're looking at gut health, obviously absorption of nutrients and different things like that is huge when it comes to gut health. I mean, that's where it all happens, right? So when we're looking at absorption, can you talk to us about what malabsorption looks like? I'm aware that's going to be a huge list of symptoms that people might be listening to, and they're like, "Oh, that sounds like me." But let's kind of walk into that, and then we can dive into what causes some of the some malabsorption as a whole.
Sure. So we started touching on this last time, of course, and part of the reason I'm so passionate about gut health is because it does affect everyone. So your athletes who are taking their supplements to build their muscles or heal their bones, it matters how well they're absorbing those supplements and their ability to heal whatever their target is, as well as all my patients. So everything we put in our mouth, right, is affected by how well we absorb it or we don't.
Yeah.
So we touched on the way digestion should look. And we know that it starts in the stomach with how much acid you make, how much enzymes and how much bile you make, so that you can properly break down and open up, if it's a supplement or something, those nutrients, and then the ability for the lining to be healthy to absorb it. So we've got enzymes that help us do that. And then the lining of our small intestine has enzymes on that border that help bring things in. It's very orderly, should be neat, packaged little things. The gut is very, very precise. I want it just like this on Tuesday at 9:00, and only on Tuesday at 9:00 will I let it in, when it looks and smells just like this. And so it tries to protect itself because there's bacteria on your food. There could be toxins, there could be pesticides, there could be alcohol that you're drinking, there could be medications that you're taking, all these things can come in that can affect you that aren't good for you. So there's a lot of checks and balances in terms of, should we absorb it? Is it okay? What do our guys say? They say it's good. Okay, Johnny, bring it in. Nope, they say it's bad. Send it on down the line. The liver will deal with it. There's a whole process here. And so all of that gets screwed up when the lining, if the lining is compromised. So when we're looking at things that can affect absorption, simply just the way the stomach, the bile, and the pancreas are working are the first step. Okay. And then it's what's coming in on your food. Again, I kind of spoke to little toxins can come in, pesticides, whether our food is GMO, genetically modified, or has some other toxins or chemical compounds in it that the body doesn't recognize. Those can affect the lining or create an inflammatory response by the immune system. It goes, I don't like this. Get it out of here. Okay. And if that's present enough, it can kick up enough inflammation that it starts to compromise the lining and the way things are checked and balanced in terms of how they're coming through. Mm-hmm. Alcohol definitely can do it. Medications we'll talk about specifically can be harmful. Bacteria that come in do make toxins that also poke holes in the lining, as do viruses, as do yeast. Anything that lives basically can make something that can inflame the lining. And then stress, we talked about this a little bit last time. Cortisol, when it's high and you're in a stressed state, depletes that protective mucus lining. That's where 75% of your immune system lives. That's a big part of your check and balance in terms of deciding, yeah, it's okay, and yeah, it's not okay. Yeah. And so if that's compromised and that's not there, stuff's getting through the border without even our awareness of it. When we look at absorption, there's two components to that. One, how things move vertically, like down through the lining into the bloodstream. And then we're looking at how things move through horizontally from mouth to anus, like motility. Okay. So those are the two things that can affect it. So if something's moving through too fast, you're just not getting enough time to sit and digest it. So if there's a motility issue, we'll go into that a little bit more next time. Yeah. The things that can affect it, definitely. And if it sits too long, that can be an issue too, because it could feed some things that shouldn't be fed. Okay. So those are all the things that sort of play into malabsorption.
Awesome.
I'm sorry. I don't think I spoke to the symptoms.
Yeah, go ahead. You're good.
It can be very broad depending upon what you're not absorbing. Mm-hmm. Usually there's some general GI symptoms of dyspepsia, discomfort, bloating, belching, gas, pain, food seeming to sit longer than it should. The belching is increased for what's normal for you, or it smells bad. The gas is increased and it smells particularly foul. It's not normal for you. Okay. So there's some kind of symptom that's going, something's not right in my tummy. And then there are a whole host of outside the gut sort of symptoms. Fatigue, brain fog, difficult concentration, difficult memory are huge because, likely you're not absorbing some of your B vitamins which are used in enzymes everywhere for energy. You can have, rashes, joint pain, trouble sleeping, nausea. Oh gosh, I mean, it can go on and on, right? But the biggest, the fatigue is huge, difficult thinking, joint pain, just feeling unwell, tired, no stamina are really big. Changes in your vision at night, those are the big ones. Okay. Mm-hmm.
Earlier in this podcast, we talked about how getting your gallbladder removed can, stop the breakdown of fats, which then decreases the absorption of fat-soluble vitamins. What are some other diseases or conditions that can cause issues with malabsorption that people should be aware about?
Malabsorption can be a symptom, just a generic symptom of something going on, like a food sensitivity or an infection, and we'll have separate lectures on that too. Or it can actually be the main process of specific diseases. So I caution you, if you're having some of these symptoms, to make sure you've had the proper workup, because it doesn't just mean you're not digesting well. It can be celiac disease. It could be Crohn's disease. It could be ulcerative colitis. I mean, it could be just a food sensitivity or a yeast overgrowth as well. But if someone's not working you up properly, or if you've tried simple things like a probiotic or a digestive enzyme or some gut healing powder and you're not getting anywhere, please make sure you get to someone. And it's okay, even if it's your primary care provider, to talk to them about, there are blood tests that you can do. You don't need to have a scope to rule out Crohn's or a colonoscopy. In fact, it can be missed by colonoscopy. I always do blood work to rule it out, especially if a gastro has not. So there's simple blood tests to rule out celiac disease, Crohn's, ulcerative colitis. There are even simple questionnaires you can do to assess whether yeast is present. You can, of course, do a stool test or a food sensitivity test as well. If that's not available to you, you can do a simple questionnaire that I have patients fill out to see how how likely it is that's contributing. And then again, the doc should be able to take a good history to assess the other things we look for in terms of symptoms of digestion. I can tell whether someone's acid is low, if it's a pancreatic issue, if they're not making enough bile. Again, their poop tells me a lot too. So you need to know what normal stool should be like. So someone should be able to entirely look at all that and assess kind of where to go from there.
Okay.
Yeah.
We talked about medications and antibiotics being something that can cause malabsorption as well. So tell me a little bit more about what that looks like. What classes of medications kind of exist in this?
Yeah, there are a lot. It's individual, but the biggest ones we're seeing are things called NSAIDs, nonsteroidal anti-inflammatory drugs, aspirin, Tylenol, ibuprofen. Aspirin definitely is one of the most toxic to the gut. It damages the liver and it puts us at risk for ulcers and inflammation in the lining. So folks can have ulcers or GI pain or blood in the stool or dark stools because they're taking aspirin, say, not a baby aspirin. That dose doesn't tend to usually aggravate folks, but they were on 320 milligrams a day instead of 80. That's a problem. Or they're taking it for the joint pain or their back pain. That's when we start to see that chronic gut issues can happen and absorption issues. So that's huge. Acid blockers are probably the next category that are used the most common. And so much has come to light in the last year. And I'm so glad to see now gastros really understanding the toxicity of these medications. They work brilliantly because they immediately stop the production of acid. So if you have wicked heartburn, they will help you feel better in the moment. And sometimes someone's in a space where their pain is so severe, it's okay temporarily. We've got to get you feeling better, but they're realizing you can't be on these drugs for longer than 3 months. One, they work brilliantly. They stop stomach acid, so it stops your ability to digest your food. We see huge deficiencies in B12, magnesium, calcium, and iron associated with these. So that can bring on a whole host of other symptoms. B12 deficiencies look like numbness and tingling from the elbows down to the hands on both sides and from the knees down to the feet on both sides. So if that's happening, you should get your B12 checked. You can have low iron, which could cause like an iron deficiency anemia. Low magnesium can look like anxiety, high blood pressure, constipation, restless legs, cramps, Charlie horses, a whole host of other symptoms, heart palpitations, and then low calcium as well. So, nutrient deficiencies, we see increased risk of H. pylori, which is a bacteria that we're not able to kill. Normally your stomach acid kills him. Well, he likes to make ulcers.
Right.
So there's, risk for infection, and now it's associated with cancer, stomach cancer. Okay. So they are taking folks off of this drug after 3 months, which is so great. However, then they're back to where they started.
Right.
You can't just come off these drugs. You have to be weaned off of them because if you're using it for heartburn, you can have a rebound heartburn that's worse than what you had before. So if you're on it now, please don't just stop it tomorrow. You can have a conversation either with the prescribing doc or a naturopath to learn what to do to support yourself as you wean off. And then you've got to treat the causes behind it, which is good because it's hopefully going to force the gastros to start addressing that or move patients to folks who are going to look at that cause of heartburn more seriously and more holistically. Birth control pills can change. They definitely can damage the lining. They also stimulate yeast growth. Yeast has an estrogen receptor, and so that makes toxins and can poke holes in the lining and cause a whole host of other symptoms. And I'll specify that in another lecture, but it can aggravate yeast. Yeah. Steroids definitely just blunt our immune response. And so our check and balance is then off, and that kind of allows things to get in that may not have gotten in before.
Okay.
I think, and then SSRIs are drugs that affect serotonin. They're given for depression, but a third of our serotonin is made in our gut, and serotonin affects gut motility in a positive way. Serotonin moves things forward. So oftentimes, if there's a lack of serotonin, which could look like anxiety or depression, there can be constipation. Sometimes if there's cell damage and too much is getting made, there can be diarrhea. And so you can see those gut issues happening as well. If someone's not doing well with an SSRI for their depression or anxiety, now all of a sudden they have diarrhea or constipation, it's because they're messing with those receptors in their gut, and that's going to affect what they're absorbing as well, even that medication.
Okay.
Oh, I forgot a big one, antibiotics.
Yeah, go for it. Go
Sorry,
for it. No,
huge. Hello. Yeah, probably the second most common.
This is a good one for people to know.
There's a time and place. There's a time and place for antibiotics. And so it really is just to be cautious. One, don't feel bad about taking an antibiotic. If there, like I said, there's a time and a place, and if you need it, you need it. You're not going to take something and feel bad every time you take it. You're taking it. You're going to get past the infection or whatever it is we're treating. But folks should be on a probiotic at the same time for the same duration. They're on the medicine, and then for at least 2 weeks after. So I usually just have them take it for a month. and they need at least 20 billion for it to be therapeutic.
Yeah.
You want to take it with food, but about an hour or two away from the antibiotic, because the antibiotic will kill the probiotic. So
Yeah.
I want to take it
Makes
for
sense.
at least 2 weeks after that antibiotic round, because it just destroys all your good flora. It destroys your army, basically. So this will prevent that and prevent the diarrhea and malabsorption that can come just from destroying your army.
Okay. When we're looking at particular areas where vitamins, minerals, different things get absorbed, you talked about calcium, magnesium, B12, iron that's typically absorbed in the stomach, essentially. Where else does absorption occur throughout the GI system?
Absorption starts in the stomach. Alcohol is actually absorbed in the stomach.
Yeah.
That's really the only thing that's really started to absorb there. The small intestine is where 90% of our nutrients are absorbed. So you've got duodenum, ileum, jejunum, ileum, sorry. The ileum is the last stop right before the large intestine. And so Crohn's disease is huge because usually Crohn's will affect inflammation in that right lower area of the tummy, the ileum, and that's where a lot of our nutrients are absorbed, particularly our bile and our B12.
Okay.
So we definitely see issues if that's been removed or if that area is inflamed. Then I'm worried about fat-soluble vitamins and B12. But your small intestine really is the main center for where 90% of your nutrients are absorbed. So that really is the area, the circle around your belly button. That whole area, it does overlay the bottom of the tummy, overlays the large intestine a little bit. But if they're having pain or tenderness or I feel swelling on an exam in the circular area around the belly button, that's the small intestine.
Okay.
And that lets me know something's going on there. And I have to do more research as to what. But yeah.
Okay. We talked about some of the conditions that can cause issues with absorption. You mentioned Crohn's as being one that directly impacts the small intestine. SIBO would be another one. Any others that people should be aware of with that particular one?
Yeah, celiac is huge. Celiac disease is like the nth degree of a gluten sensitivity. It means when you're diagnosed with that, you cannot have wheat or gluten because your immune system will attack the villi, which are the little finger-like projections on your tummy that do all the absorbing and will demolish them to the floor.
Right.
So there's zero absorption of anything. This is why these folks are so sick, because they're not absorbing any of their food or any of their nutrients. And they have a whole host of varying symptoms. But they also, aside from celiac, when the gut is that sick, they also develop lactose intolerance and dairy sensitivities because the enzymes that tolerate dairy are made on those little villi.
Okay.
And so in the beginning, when someone's even really significantly gluten sensitive, they may also find they have a dairy sensitivity that may get better over time. I would recommend that they avoid dairy while they're healing because they do not have the enzymes. They don't have lactase and they don't have the enzymes that deal with casein or whey. And so they can also look like a dairy sensitivity. That may not always be the case. As you heal the lining, they may be able to tolerate that just fine. But if you're finding that you don't do well with dairy, it's probably because you just simply don't have the capacity to deal with it.
Okay.
And SIBO is a small intestine bowel overgrowth. So it's an infection in the small intestine of bugs that should not be there. Basically, they make toxins that poke holes in the lining that then allow everything to just get dumped into the bloodstream and create an inflammatory response. The immune system's like, what is all this stuff doing here? Get it out. Oh my God, what are you doing?
Right.
But also, those bugs just get first pass at everything you put in your mouth and it gets turned to gas. So all your food, all your supplements, all your medications, they're absorbing it and fermenting it to gas. And so those folks have major amounts of bloating and belching and distension. They look pregnant. There's a huge amount of gas that has to be present for us to think about SIBO, but it's definitely got to be treated with either a natural antibiotic or an antibiotic. And you can, underlying that's a motility issue as to, we'll talk about that a little bit, as to why it got there, but that definitely will affect your absorption. You can't, when we're treating SIBO, you're off all your supplements other than necessary medications. You can't take anything else. Because you're not absorbing it. There's no point. I don't want you to waste your money.
Yeah, that's fair. One of the things that in school when I was taking the gastro course that I was fascinated with was the villi itself and like the physiology behind what it can do, how it can be impacted. Can you kind of just go into an overview of what that looks like?
They're so amazing.
Yeah.
I love these little guys. We're amazing. I'm sorry. I'm a nerd out for a minute, but you've got miles of villi, these tiny little projections that increase the surface area by 1,000%, right? And it's exquisite how we're able to take some giant meal and break it down into the simplest little particles, one single amino acid for your protein, one single sugar, from your carb, one little fat, from all these giant fats, right? And bring it in. And there's a beautiful system for where it goes.
Yeah.
So the cells talk to each other. They're allowed to say, hey, Joe, do you need some carbs? I've got some. Do you need some? Hey, Sue. Oh, cool. Right, left. So everything gets to move fluidly. There's a fluid conversation and balance. It's beautiful. And then when the blood goes, yeah, sodium's getting low. We could use a little down here. They push it down into the bloodstream. So it's just, what do you need? How do we get resources where they need to go? And it's a minute by minute conversation. And it's so beautiful, the adaptability, right? It's perfect in its nature. Ideally, no toxins are getting in, no bacteria is getting in. Everything is just allowed. Your sugars come in, like sugar comes in all by itself, which is a little bit of a problem with fructose. He doesn't need anybody to regulate him. And that's why we don't really like fructose, because you can eat a lot of it and then it just gets stored as fat. So, but everything else has a rhyme and a reason and a buddy system. There's a protein that takes this, little piece of protein in. There's a protein that takes that little bit of fat in. A lot of our fats, though, get stored in the lymph. There's a little lymph node vessel in the middle of the finger-like projection or whatever, and that takes the specific fats right to the liver. So there's this just beautiful delivery system and this perfect rhyme or reason. And I teach my students, you're only as good as your tight junctions, which is like the gut lining, right? Is like a brick wall. It's like a brick wall and everything is nice and tight and nobody gets anywhere unless we say Tuesday at 9:00.
Right.
And as those toxins get in, they break those tight junctions down. That's what makes it leaky and the cells swell and then they become parted and there's a tunnel between them where everything gets in. Food, bacteria, toxins, whatever it might be. And that's where we get the compromised, leaky gut. Things are leaking in when they shouldn't be, when we're, so you're only really as good as your tight junctions.
Yeah, absolutely. Thank you for explaining that.
Yeah.
Now, just kind of wrap up this episode. When we started talking about absorption, you mentioned there's a vertical passing and then there's also a horizontal passing. So we just discussed what the vertical is. It has to do with villi, these finger-like projections that take in, vitamins, minerals, carbs, fat, protein, all that stuff. There's a horizontal aspect, which has to do with motility, which we're going to discuss on our next episode. Kind of recap on what you said about that as far as, what motility is, why it's important, and then we'll obviously jump into more detail on it on the next episode.
So the gut naturally moves things, forward, right? So we can have a bowel movement. When you eat food, it causes a reflex called the gastrocolic reflex that yells down to the large intestine, make room, we're having a meal coming in, So there's a natural progression of wanting to move things out so everything can move forward. And it's a one-way street. It's supposed to be a one-way street. Every 90 minutes that you're not eating, there's this beautiful motility complex that there's a nice sweeping. The gut sweeps itself. It cleans itself. It moves everything down the line. So bacteria don't get to stay too long. If there's a toxin in there, he's moving on through. We do not need it, right? If you're grazing all day, that doesn't happen. So there's things that can interrupt that just natural sweeping. And then we look at the elements that affect how fast things move forward, right? So we'll look at how, a normal bowel movement, if you eat corn, you should be able to see that in your stool in 12 to 24 hours with an average of about 18 hours. So, that's a normal range for motility. Anything outside of that is considered too much or too little. We're looking at diarrhea or constipation. Okay. And then the things that affect motility are stomach acid, pancreatic enzymes, bile production, serotonin production, and the vagus nerve, right? The big nerve that serves all the muscles and tells them how to contract. So when we're looking at, and an infection can also affect that. So we'll look at all of those factors next time when we talk about how things move forward or backward, which they shouldn't.
Awesome. Thank you so much, Dr. Retz. Thanks for being on this podcast. I love how you personify the different organs and different aspects of our gut. So thank you so much for making it entertaining.
My pleasure.
Hope everyone enjoyed this episode. We'll catch you on the next one.
Wanting to look youthful and age gracefully? Our team at Ethos Aesthetic Medicine love working with individuals who want natural-looking results with minimal downtime. Our Ethos Glow approach is designed to help you show up as your absolute best self by giving you brighter, more even, and youthful-looking skin. Ask our team how you can get more information on our Ethos Glow approach to achieve natural-looking results that make you shine.